everyone. A very good morning to Dallas, and a very good morning and evening, afternoon to my global viewers. Thank you so much for joining, and welcome to the show Global Capshup on Asia News. Today, we are actually going to discuss something very important topic um, that needs to be addressed universally because today we are going to talk about autism. Autism is a developmental disorder that comes with many symptoms like difficulty social interaction, communication, and so on and so forth. So many kids, adults all over the world are suffering from this disorder. So today we have guest in our studio who is an expert to tell us, what the autism is about. And so we are going to invite her to the studio. So, and let's welcome Dr. Um, Sailaja Golla here. Thank you so much for joining. And this is a pleasure having you in the studio. So tell us a little bit about yourself. I know you are a pediatric neurologist, and then you have studied autism in detail, and you have won so many awards, including, the D Magazine's Doctor of the Year. So with all the awards and your wisdom, we would like to share something that we all have questions with all the audience as well as us, and let's learn in detail about the autism.
Thank you so much, Anu, for a great introduction. And I would like to thank iAsia News, Anu and Mr. Krishna Garu for providing me this opportunity to raise some community awareness about autism and share my views on it. Thanks again.
So you have worked extensively in, in this field with the UT Southwestern, and also, and did your internship in New York, and with all the field, different places of experience. So tell us a little bit about what this autism is, and like many parents are so confused about with the different aspects of this one and reasons like why, where, and so what kind of like a signs or a red flags or any kind of things that they should look for?
Autism is a neurodevelopmental disorder. I would hate to call it as a disability because they are children and adults and they should be treated as normal. And I also avoid the term special needs because they are one among us. It's a neurodevelopmental disorder. So there is a genetic as well as a neurologic basis. Some of the red flags to look for in autism is it usually presents around 15 to 18 months. And if a parent notices any sudden regression of speech or social skills like eye contact, flapping of the hand, spinning in circles, those are all red flags and a concern. A teacher can notice it, a babysitter, a caretaker, a grandparent, anybody who notices it should bring it to the concern of the pediatrician.
So let me, tell a little bit about you also, because when we were conversating earlier, that I was very impressed by your experience and all the work that you have done. So, folks, that let me tell you what she has done in work in this field is she's a pediatric neurologist, like I said, an autism expert, of course, and then who works at Texas Institute for Neurological Disorders in Dallas here. Am I right?
That's correct. Yes, my office is in Frisco and Plano, and right now I'm in the office at Richardson as well. So all over Dallas.
All over Dallas. So that's an excellent, and also that your many literatures, and also that your write-ups and the interviews has been given to inform and give a lot of answers to this autism. So with that expertise, let's take a little bit step ahead, and then let's say like what all other things that we can learn about autism today, because I know a lot of information is available online, and but hearing from an expert makes a huge difference, because you have, like, face to face, one-on-one experience with all the things that you have done. So the first question, what exactly causes this condition?
There are multiple causes. In the past, there was a misconception. So let me start off with what does not cause autism, so it's clear to the public. Vaccinations do not cause autism. It's not the mom. I know a lot of people call this as a refrigerator mom, where mom does not take care of the child at a very young age, and that's why the child has autism. And I see quite a lot of parents who blame themselves, like the mother says, oh, there should be something wrong with me, and that's why my child has autism. So please stop blaming the mother. So the refrigerator theory, which was long back in the 1970s, calling or blaming mom, is gone. Some of the causes for autism is genetic as well as neurologic causes. 10 to 20% of the time, we do identify a genetic cause for autism, and hence it's very important to approach your doctor, whether it be a neurologist or your pediatrician or your psychiatrist, to go ahead and do some genetic testing, which might help find the cause for autism. There are other causes like prematurity, depends on the mom's age as well, if she's very young or very old, if she had any complications, any birth injuries. These are all some of the other causes of autism.
So excellent, actually. And let's go over the details in a while. But before that, so I believe, okay, this is going to be a very interesting question, because, like, as we see these moms with the kids with this disorder, many parents, I believe many parents are not very comfortable. And as a matter of fact, they're against getting vaccines for their children, especially the MMR. So do vaccines actually cause autism, or is this just a misconception?
Anu, I'm glad you brought up that question. That's quite often I do get asked about vaccinations. And a lot of people, even today, do strongly believe that vaccinations or immunizations is the cause of autism. And I do feel in their shoes, but definitely it's not a cause for autism. Unfortunately, 15 to 18 months is the time when a child gets the MMR vaccine, which is the most common one to be blamed, and at the same time you see signs of autism, and a lot of parents swear that, hey, they got the MMR vaccine, had a fever or whatever, and in 1 week my child stopped speaking, my child stopped socializing. So in the past there was a lot of research done, and right now it's proven that vaccinations, immunizations do not cause autism.
So that's very clear. Thank you so much for clearing that subject, because I think a lot of parents are concerned, as a matter of fact. And then, we can avoid, these measles, mumps, and rubella, then, by getting this vaccination, which is a blessing for other children. So, see, let's say that once this, our children got diagnosed with this autism, so is there any way that we can find out whether it is a inherited, or so how do you know?
So
Is there
autism,
any specific test that we can
yes,
get that?
yes. Yeah. So autism, like I said earlier, 10 to 20% of the time, it could be genetic. Genetic does not mean that it has to be hereditary or run in the families. Yes, if there is a family member affected with autism, another sibling, a parent, or uncle or a cousin or whoever, the child is at higher risk for autism. In addition, the child can have a new mutation. So genetics does not have to be hereditary, is what I'm trying to say. There are specific tests, and either your pediatrician or a neurologist. So if you go to your pediatrician, he does some tests, but if they're not comfortable doing genetic tests, usually they're referred off to a geneticist or a neurologist. And we have a few of them which are again approved by the insurance. We do like something called as chromosomal microarray and fragile X syndrome, and I'm telling those medical terms just for our listeners to be aware of that. When you see a doctor, feel free to ask for genetic testing, but also these two specific tests, SMA and FXS is what it's called. Why do we do that? How would it change? Yes, there is no cure for autism as of today. There are therapies. How will it change? If you know the cause for autism, it will help with genetic counseling. If the family is planning to have another child, what's going to happen when the child gets older, when he decides to have a family? Or is there some research going on where there is a treatable cause? Do we need to look at heart, lungs? For example, with some syndromes, genetic syndromes, they also have kidney problems, other problems. So it's going to help us understand the disease, and also there is a small chance that the treatment can be altered. So I would strongly recommend genetic testing in today's world.
That's excellent to know that that testing can be done. So I have another question just to connect with that one is, so like once we find out it's hereditary, so is there any way we can find out like who is the contributor of that gene, whether it comes from a maternal side or a paternal side, that how do we find out? Is there a way to just so that they can have they can be aware and just take a precaution for the next child?
Yes, there is a parental testing available. So if the child's genetic testing is abnormal, the parents quite often have an opportunity to test them. So if the dad or mom carries the same mutation or abnormality, they might not have symptoms, but they might have passed it on to their child. So it does help, and we have an option to test the parents.
So you said that it can be a possibility that the next child, the second one, also can get it. So
Yeah.
depending on the percentage of the contribution of the gene or the where it comes from.
That's
Okay.
correct. It could be anywhere from 30 to 40%. There is no clear percentage, so it's hard to predict. What I tell families if they decide to have another child is there is a 50% chance that another child can have autism. So that's kind of, if they're deciding, if the mom is deciding to get pregnant or have another child, it does help them if they know that there is at least 30 to 50% risk that the other child can have autism.
Okay, so how early can you detect this one? Like I know that as soon as maybe a parent notice something. So how early can you tell that child has this disorder?
Typically, the diagnosis is anywhere from 18 months to 3 years of age.
Wow.
Unfortunately, since it's underdiagnosed globally throughout, it could take as long as 5 years. I have children who are newly diagnosed with autism at 8, and it was missed earlier. And if you go back and see a lot of these adults now who are in mental health facilities and stuff like that, a lot of them probably never got tested or underdiagnosed. But talking about new research, you can even diagnose a child as early as 7 months, 6 months, when they lose eye contact, or obviously a child has to smile at 2 to 3 months, recognize mom, enjoy peekaboo at 7 to 8 months. So if they're not doing that, if they're not babbling, and if the mother is or father is observant enough, they can always go ahead and approach the pediatrician. There is also new research that you can also detect through pregnancy. So sometimes they do offer high-risk moms genetic testing while they're pregnant. Also, after the delivery of the baby, there are some new studies showing that the placenta of the mom has some abnormalities, which indicates that the child can have higher risk for autism.
So is this a gender specific by any chance, like whether it has to be like more in female and less in male, or the other way around?
It's more in males, unfortunately. It's 4 times more common in males. And so males are more predisposed. And Anu, right now it's 1 in 57. We can't believe, like, there is a group of 100 people and a couple of them can have autism among them. So it's definitely increased, and we don't know if the increase is just because there is more awareness and getting more diagnosed. And some people ask me, is there something in the environment? Why didn't we have this autism as much in the past? And right now it's like all over. So that still remains a puzzle, but I think it's more awareness, and it's been underdiagnosed. And girls are again, the little ones, they're not so hyperactive compared to boys in general. It doesn't have to be an autistic good child. Boys are more hyperactive, more outgoing when they're
Right.
younger. Girls are more perfectionist and they try to hide when they're little, and even older.
Of
So I
course.
think, so I think these components, females are underdiagnosed because they are more inwards and they try not to show off the features,
Right, right.
activity, and so on.
So, and adding to that one, like, as it is, the symptoms of this like disorder is a lot more, and to confuse that one, there are more ASDSs. So let's touch a little bit about that one as well. So we heard about the Asperger's, like that also has a similar symptoms and sometimes can be confused with this one. So are they related by any chance?
Asperger's syndrome in the past, it was included in the autism spectrum disorder. So autism spectrum is an umbrella which has many disorders. Right now it's taken off for several years. I think it's more than 5 years since Asperger's is out of the autism spectrum and it is a separate disorder.
Okay.
The reason it was earlier in the autism spectrum is they share some characteristics. So one of the big characteristics Asperger's and autistic subjects have is they have this social avoidance. They try to be by themselves. They don't socialize, the eye contact and all that, and hence it was included. But one big difference between Asperger's and autism is language. There is a history of speech delay with the autistic children, and Asperger's, they do not have speech deficits. They might have odd speech, but they're able to talk in sentences. There might be some communication impairment with Asperger's, like two-way communication, but they are usually very high functioning and they do not have any speech delay as a child. That's one big difference, and now it's a separate disorder and not in the spectrum.
Not in the spectrum. That's good to know. Is there any other ASDSs that we should be concerned about, like to relate it to this one?
Yes, in girls, there is something else called as Rett syndrome,
Rett syndrome. Uh-huh.
Rett's, yes. So we always check genetic testing. If I see a girl suspicious for autism, I also add what is called as a Rett's panel. It's another genetic testing, and girls who have Rett syndrome can have autism. In the past, there was also a terminology called as pervasive developmental disorder, which was another term for autism that's been taken out as well. So these are all some of the causes, and most kids have this ADHD symptoms in autism, hyperactivity and inattention. A lot of families come in and ask me, I don't think my child has autism, maybe the child has ADHD, but ADHD kids just ADHD, they have no autism, like the social skills are normal, and they do well with some ADHD medications, which is different from ADHD related to autism, because most children with autism have ADHD, but they also have these other things like the social skills I was telling earlier, flapping, spinning, likeness for routines, poor eye contact, and so on. So it's very important to not label just ADHD when a child actually has autism.
That's wonderful to learn all this in depth. That it is. I hope this show is helping many parents who are going through, especially during this difficult time of a COVID. So let's move on with our next, even more interesting one. Like I know that autism can be diagnosed in children as well as adults. So how do they best cope with this, their learning skills or a social skill, or, like many areas that we think about is like, their efficiency and accuracy requirements, once they start working at their work as a team building. And, do you think there will be very specific limitations, or how do they affect it? And what, like what your advice to the patient or even the caretaker for this kind of a disorder?
So every child or adult with autism is so different from each
Right.
other. So, and again, it is individualized, but given today's advances, there is a lot of things they can do. In general, most people with autism do have some gifted things. Like, for example, they're really good at puzzles. There might be a high functioning, meaning very well spoken artistic person who is really good at mathematics. They can be radiologists, for example, who are behind the screen. I have a person who I know who owns a studio movie grill, for example, and he has high functioning autism. You just don't need that social interaction, but you can do a lot behind the screen. But these are for milder and high functioning autism, and it depends if the child or adult has severe autism, for example, having a lot of behavioral issues, cannot speak or nonverbal. They have a lot of programs where they can work, like doing bracelets and things like that. There's so much they can do, but all this going back, they need those therapies much early in time, and the therapies are called as ABA therapies in addition to speech and OT. ABA is a special form of behavioral therapy which helps children and also adults with autism, where they teach social skills and so on. The earlier, the better. And at least 30 to 40 hours in the early stages of autism can actually reverse some of those symptoms. And it's almost like a cure if it works well for that particular child.
So may I ask what ABA stands for, and then what is exactly, in a very, like, a little bit, just to for our audience to know quickly?
Yeah. ABA is applied behavior analysis. It's a special form of behavioral therapy, specifically for children and adults with autism. They help with social skills. Social skills meaning eye contact, two-way interaction, joint attention. They also help with those repetitive behaviors which we see in autism. They also help with the sensory things, like autistic children can be sensitive to texture, sound, smells. Also, they help with two-way communication. Many autistic children and adults have what is called as echolalia, like repeating the same thing again and again. So ABA definitely helps them with that. And I always tell parents when they start off at a very young age for their kid to also participate. Parental involvement is very, very important in ABA therapies. There's no point getting 30 to 40 hours per week, and if you do not apply those principles. Just to give an example, they try to help with feeding and the child is independent with feeding. You come home and the grandmother feeds the child and they do a whole new practice at home, which doesn't help with ABA. So it's very important among all the caregivers to follow the ABA principles, both at the ABA place and there, because you can't receive ABA all lifelong. You have to graduate someday and apply those principles at home.
Any certain level of a severity this can be whether works or not can be decided for this kind of a therapy?
Yes, ABA usually works if the child's comprehension is good and the IQ has to be at least not very severely down. So they should have some comprehension and a good IQ. Also, some speech would be beneficial because they need to communicate and learn those skills. And if they're very aggressive, if they have self-injurious behaviors, hitting, biting, pushing, kicking, and they're not cooperative for ABA, it might not help. So it usually helps with mild to moderate autism. The severe autism, it's a little challenging, but there's no harm trying out. So anybody can try out ABA therapy.
Okay. That's wonderful to know. So we just talked about ADHD behavior with the child with the hyperactivity and all that thing. So like a lot of parents try their best and their level best to calm the child down. And there is a very wonderful treatment called pet therapy that I've heard of. So I want to know a little bit more about that one, so that like if there is any way that that it can help. Probably, I think that's a wonderful treatment to go for.
Yes. So autistic children and adults are visual learners, meaning that if it's visually presented in a way, it's better than auditory learners. So PET system, which is basically using pictures, like the P stands for, uses pictures, stories. It's also called as social stories sometimes. So they use pictures and actual things to show the kids. For example, hey, this doll is having a birthday, and these are all the other dolls where they are clapping their hands, or showing a video, for example, how a birthday looks like, rather than just telling, okay, this is a birthday party, the child blows the candle and then everybody clap. If you show it to them, it's better. So that's the principle behind the PEC therapy, and it does help earlier in the autism stages, when they're very young, for example, around 20 months, 24 months, even at the age of 3 to 8 years. But it does not work as well with the older population once all their skills are learned.
So I think, yeah, overall, I think, like, who doesn't love pets? I think if they are the cure, I think, we all should support that one and, go for it. I know
Yeah.
sometimes it's hard to afford.
Sorry, Anu, I went over the
Go ahead.
PEC system, the picture system. Pets. Pets, okay. Maybe I'm on.
That's okay.
Yeah, so PECS is one way to learn too. PECS is the picture identification system. PETS definitely helps. PECS,
Okay.
among the pets, 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 and
Yes,
there is
yes.
PECS, PECS. That was a good one.
That's
Okay,
okay. We learned something extra, so that's that. Thank you.
A little bit of laughter is needed than to be. So, pets, any type of pet. Some of the pets I would suggest for autism is dogs, cats too, but dog therapy really helps. Your provider can also provide a prescription, because dogs are quite expensive. They range anywhere from 1,500 to all the way up till $5,000, and a lot of families cannot afford. The dogs develop an emotional bonding with the child, and emotional ability is one of the strongest deficits we see with autism. So pet therapy, dog therapy definitely helps. They can either take them to a place, for example, in Dallas, UTD offers pet therapy, the dog therapy, and there are other places as well. Where they have centers where they do the dog therapy. Hospitals have that as well. So please try, if your child is interested in a dog, please go for it. It does have skills. And it does have equine therapy. I know you can't have an horse at home, but
right.
equine therapy is basically, they're expensive too, and your doctor can write a prescription for that. It does help with a lot of children with autism to develop that focus and motor skills. So these are some things which are there out there, and you just have to explore. Music therapy is another one. Which is really useful for children with autism. So just do not hesitate to explore the things which your child is interested.
I mean, this is really a blessing, because I think, the being such an intellectual animals, they can help calm down, a child. I think that is the best therapy that I would go for sure. So thank you for giving the details about even music and the other picture one also. So let's move on to the even more serious issues with this autism. So sometimes, when we like, if we are not at all aware, and then a child is getting a seizure, or like all of a sudden that we don't know that, and is there a risk of that, increased risk for seizures or epilepsy, with this disorder?
Yes, there are a lot of comorbidities associated with autism, and seizures is one big thing. Children with autism are 15 to 20% more prone to have seizures compared to any other child. So, and it's very hard in an autistic child to say if it's a seizure. And to talk about seizures, seizures in kids present with different ways. It's not like a whole body seizure like you see in adults, where the eyes roll roll up, they're foaming at the mouth. So that doesn't quite often happen in kids. They can just stare off into space. They can have some odd eye movements. They can just shake one side of the body. And in autistic children, some of those are confused with stereotyped repetitive behaviors, because an autistic child flaps, they have odd hand movements, and so on. So if you are suspecting a seizure or your child is not responding when you call the name, please approach a pediatrician to refer to a neurologist who can take care of that and do studies like EEG. Also, other comorbidities, sleep problems is quite common. At least 30% of children with autism have sleep problems. They have anxiety. Some of them have gut problems like constipation, diarrhea, and so on. So these are quite common, and it comes with the whole package. It's not just the social skills and speech.
Wow. So that's definitely something that that we all need to address. And let me I want to clarify something. I don't know if it's a truth or a myth. So let me ask you. So a lot of times, like, we believe putting metal in a person's mouth, or so that can bring down the like a level or the severity, whatever that you can call as a down when they are having seizures. Is this true?
Never put anything in the mouth. First rule. That was the old time,
Or in the
maybe.
hands, I think. So I have seen people putting it in the mouth or hands, or like so many times that I have no idea. But I'm just always curious to see that whether it is true or not, or what exactly. Even if it's true, then what exactly does it do? So
Yeah, no, never put anything in the mouth. You must have seen it in movies and old days. That's actually very risky. When a child has a seizure, put them at the side. Do not panic. That's the first rule. Obviously, you call 911 if it's a first time, or if the child does not have a history of seizures. And then do anything like a key or anything, it can actually choke on the child. So never put anything. If possible, put a hand or a soft pillow under the head so the child does not have a neck injury. And then obviously you call 911. But if a child already has a seizure disorder, then you know what to do. We also have emergency rescue medicines, which a parent can give at home. When a child has a seizure for more than 4 minutes, before 911, medical personnel usually take about 5 minutes, or sometimes it takes longer, 15 to 20 minutes. So there's something which a parent can do. It's just a rectal suppository, just like Tylenol suppository or glycerin suppository we use, and it immediately stops the seizure. But do not leave the child in the pool. Pool is a high risk. Even a bathtub, they can have a seizure for just like 1 or 2 minutes. So those are all some places where a child with seizures has to be watched, and absolutely driving is a big thing. So unless they're seizure free for 6 months, I usually do not advise driving.
So, do seizures last? How long do they last? And then, so is there like a time period that, okay, I'm completely free of seizures? Is there, with this disorder?
Yes. So in general, seizures can be different types. So there are some seizures which can last lifelong. There are some seizures which don't even need medications. They're benign seizures and they go away as the child gets older. So it depends on the cause of the seizure. Most of the time, the general rule is 2 years seizure-free on medication. So if child or an adult does not have any seizures for 2 years on medications, then you can talk to your neurologist to see if they can slowly take them off over a period of 2 to 3 weeks. And that's the general rule, but again, it varies with the type of seizure.
Most of the time, that parents, the like a high concern that I've heard from many parents with autism children are they have a insomnia or like a sleeping difficulty, and that may trigger the seizure or even the increase their, like the symptoms of autism. So, what do you suggest? That what is the best way to bring it down or make them feel comfortable with sleep?
Lack of sleep is a big risk factor for seizures. So sleep is very essential to everyone, and especially if they have seizures, just missing a night of sleep can provoke seizures. There are a lot of things we do, and especially now with this COVID situation, I think sleep is a big thing. Everything has changed day in and day out. So please take your medications regularly and try to get sleep. And there is something natural I would like to tell the listeners. It's called as melatonin, and a lot of shift workers use it, and it's natural. It doesn't hurt. All of us produce melatonin when it gets dark, and sometimes when there is a change in routine or something different happens, then the melatonin is not produced. So it's okay to give melatonin to a child as young as 2 years of age, and there is no age restriction basically, and it comes as gummies, tablets, so, and you can use it as needed. It's not a medication, it's something natural, just like a multivitamin. It's a hormone, so that's something you can try over the counter. Yeah, it's over the counter too.
Okay. So, and let's just, like just we mentioned about the COVID, before even that one, let's say, like, recent observation, or even like we read in everywhere, like magazines or scientific research or any of this recently, that we have been learning that the statistics of this autism is going up. And is there any specific reason, like our food or environment or any kind of a changes in our habit behavior, so that why is it that like we don't see that one going down, instead it's going up?
Yeah, that's quite a common question we get from a lot of families. Why is autism so much now compared to what it was 10 years back? It's more awareness, like I said. But yes, there are a lot of studies also done with regards to diet, with regards to environment, chemical exposure, pollution, and so on. But nothing has proven that it does cause autism, because autism is prevalent as much as here in USA compared to any other country like India. It's just not diagnosed unless they're exposed to real heavy metals like arsenic poisoning, or they're in a house where there is some kind of lead poisoning or paint which has been chronically exposed. But otherwise, typically there is nothing clear. There is this what is called as environment gene interaction, like for example, nutrition can be considered as a significant cause. Like a mom was malnourished, and the child is at risk for autism, and he also has a genetic predisposition. So there's a lot of things which are done if there is a chemical exposure or something in the environment. But as of today, we do not have any clear correlation between something outside in the air which can cause autism.
Okay, so let's I think my next question is going to be a very interesting one for you. Let's talk about CBD. We are hearing a lot more. I know that you're going to laugh at me, because I've heard a lot about this one, and so good and bad. But at the same time, there is a belief that it plays a very good. I don't know how many people right now know that what I'm actually asking you about. So what I mean, do you really think it plays any important role? Because I know nowadays that like shops are popping up just like that everywhere. So so what is your take on it?
Yes, so I would like to emphasize to the listeners, there's something called as medical cannabis, and there is CBD oil out there everywhere, like at least in Dallas here, I think every couple of blocks outside have a CBD shop, hidden or not hidden. It's so freely available. And talking about the autistic community, we do not have any evidence-based research that it can change behavior or language with autism. So that's a go-home message. Yes, can it be used for other disorders? There is research being done for seizures. Seizures, it is medically approved now for a specific type of seizure, or if they fail like 4 or 5 different medications, that's the last resort kind of thing. And for other certain conditions, Alzheimer's, Parkinson's, they're still investigating it. Similarly, for autism, there are research studies going on. And many parents ask me in the clinic, like, hey, doctor, can we take CBD oil? I say I cannot prescribe it, but yes, if you feel like it's making a change, as far as it doesn't hurt your child, it doesn't have many side effects. So try it, but I haven't seen any response in the kids who have been using, nor is there any evidence right now. But there is a website called as clinicaltrials.gov. If the family is really interested in a medical cannabis trial for autism, look up there, and they are research proven and they can take part in the study. But as of now, we do not know if CBD or medical cannabis can help autism. We do not have much evidence.
Okay, so like just to audience to know that I know they are all wondering why we are laughing, because the CBD, the very common word for this one is marijuana, that we actually do see
Yeah.
it with all the different the viewpoint. But since this one is a medical term, so then it is going to help, or hopefully with the clinical trials and everything. So as we go, hopefully it will help. So then we will know whether it's good or not. So let's hope that the result will be good. So let's come to the little bit of a the topic that as like what we are going through right now, which is a pandemic. The COVID is one of the also the biggest concern that we all have for autistic children or adults. So
Mhm.
let's start. Like we mentioned that we are all locked down. We are all just nowhere to go, nothing to do, so that we are hooked onto our gadgets, like the YouTube and like what we are doing, like so that the FB Live or watching a lot of videos, movies. So recently we heard a lot of different stories about the YouTube broadcasting some of this horror scenes for children that are not very healthy, and they can get they start harming themselves. So autistic, so to what level these kind of, like, even accidentally, if autistic child that sees these kind of movies or any of the videos or games, so that like is this even good, or like they have to completely block those kind of things from their child?
Very good point, Anu. We know in today's world we cannot live without gadgets.
Right.
Adults included. So we are so
Absolutely.
much hooked up to our phones and all that. But talking seriously about the video games, a lot of autistic children are more fascinated towards the video
Right.
games. And I do remember that thing which was recently in the news and YouTube and all over. It is concerning because some of the things, specifically with autistic children, they try to imitate the stuff what they see on that and try to incorporate it, which can be dangerous. In general, no more than 2 hours of video or TV or whatever time is allowed in general for any kid through the day, and that's tough with the COVID stuff going on now, but limit it to 2 hours. And if you do want to see something with the child, make it interactive. Watch the TV show with your child rather than just having them watch whatever he's watching on the phone. Try to make it interactive, but please limit it. And I would definitely restrict those violent
With
video games for
videos.
sure. And also some of those video games which have a lot of flashes of light can also predispose to seizures too. So please avoid that. And also some of those lights, the blue light, for example, it's not good when you sleep. So avoid using a blue screen as a wallpaper on your phone. So that's something to do with the blue light. And I just wanted to bring in that small tip inside there.
Oh, absolutely. So I think yes, anything that we can do to protect the child, it's definitely worth it. So also, like how do you positively communicate about this condition, like wearing a mask or social distancing, like because they do not understand when they are hyperactive, and it's going to be a big time restriction for them, as it is they are restricted, and it's like a one step ahead. So how do you communicate positively to let them know that what is good or bad for them?
Yeah, in general, children, but specifically autistic children, they negative reinforcement does not work.
Right.
Timeout,
Mm.
spanking, hitting does not work at all. So try to do positive encouragement and ignore the negative behaviors. That's rule number one. Because if you encourage some of the positive behaviors, like hey, the child has used his fork and is eating without watching the video game, for example. So reward him with something, and that helps. helps the child. And now with COVID, I think there is so much of restrictions to get therapies and all that, but there are online things they can do. And again, like I said, just don't leave the child in front of the computer. Try to make it interactive and see if you can interact with whatever they're doing, therapies or whatever. And that kind of helps a little bit. Also, the incorporating the ABA rules will help. Giving them a check mark. Autistic kids usually go by checklists and routines. They need something on the fridge, so just make sure, hey, have breakfast, do this, and then whatever. And it really helps making the checklist and making a regular schedule. Helps a lot with the autistic population.
So the regular organized schedule can just, lessen the confusion for that child, and then, keep it going with the positivity. I think, yeah, that's a wonderful thing to know. So let me ask you something very personal question also to you. So like I believe you're still seeing patients, right, in your office. So I mean, how do you do it? How do you deal with it? Because I know that, like you said, that children with autism, they don't understand sometimes, and especially the younger kids, and they also get repelled by the negative, behavior. So how do you deal with it? Like, as a mom or maybe as a doctor, or so how do you do it?
It's a little challenging with what's going on now. We are not able to physically see them as much, but I think many insurance companies have stopped paying for online or televisits now, and we are seeing kids in the clinic. So I am seeing at least 60 to 70% of them in my office for the past couple of months, and then we are doing the online visits as well. But it's definitely challenging for an adult. You can tell them to, hey, you need to wear a mask when you enter the clinic, and you need to do this, wash your hands and all that stuff. But a child with autism, they don't wear masks. They just touch everything around. So it's been challenging to the autistic community. And telemedicine works well in terms of seeing the patient for autism from my perspective. Maybe not some other fields, but most of my families are happy to see me on the television, and I can observe their behaviors in a home setting. They're more comfortable, speak to them online and all that stuff. So yes, please ask your doctor about telemedicine. Also, do not stop therapies. ABA, speech, OT are restarting now. So please go ahead and call your school district or your ABA therapist to make sure you restart it, and they have they can come home sometimes and do those therapies. But there is also online therapies available, which might not be perfect, but something is better than nothing.
So that's wonderful to know, because thanks to technology that we are still connected throughout the world, even though we feel that world is coming to a stop and life is stopped somewhere, that we still need to push it. And yeah, this technology is definitely supporting us. So quickly to ask, what are the best activities that you recommend? I know that all children are bored, and autistic children especially, then their activities are totally different. And so like you suggest that we are not giving them much access to these gadgets of like a limited to video games. So how do you get rid of this boredom for them? Like what do you suggest?
Yeah, it's quite challenging, especially with working parents who have an autistic child who they need to take care of, and losing jobs and all that stuff. It's definitely challenging. I would like to recommend a website where they have a lot of activities specifically for autistic children. It is Autism Speaks, like the word speak, speaks.org, and they have a whole set of activities involving interactive games. Again, some of them are online. Also, things which are good for autistic children, martial arts, karate is good. Music, for example, put them in a music class or have the music teacher come home or online. That helps. Parks is something I am anti. Especially for autistic children. Now I know all the parks are opening up, but they will be touching, licking the swings and all that stuff. So it's not a good place for children to go to the parks yet, is my personal advice. I know it's hard to keep them, and we recently had a huge outbreak in a daycare here in Texas. You might have heard, Anu. So daycare is another huge risk, but again, it's risk
Right.
versus benefits. The mom has to go for a job, the dad has to go for a job.
Right.
Yeah, so it's hard.
Yeah, we do understand, parents, like difficulties, but at the same time, the safety comes first, and then, anything to just keep them safe, that has to be a priority. And I agree with you. So, well, our viewers has been great, and then, they are giving a lot of feedback here also, and also that, I received some questions. So, as we go, like, and you're ready for that? Like, I'm going to give you a couple of them. This one is from Vidya. I think she has a lot of them. So let me start with thank you, Vidya, for joining. And this is for you. So, do adults suddenly develop autism? This is Vidya Sagar that she wants to know.
Very unlikely that adults suddenly develop autism. They might have features early in childhood which might have been misdiagnosed. Majority of autism is presented at the age of 15 to 18 months, around 2 to 3 years of age. Very unlikely that an adult suddenly develops autism.
Okay, that's. I hope it answers. And I think this is Gauri and Gauri Janakar Chowdhury. So she asked, like, how important is the nutrition and diet in autism?
Oh, thanks, Gauri, for bringing it up. And I know Gauri is an expert with nutrition.
Yes, absolutely. I know.
Yes, yeah. So nutrition plays a huge role. A lot of autistic children also have sensory integration issues, and they don't like certain the way textures of food feel, and it's quite challenging. Like, hey, my child eats only chicken nuggets or French fries, and he doesn't eat mashed potatoes. So they like crispy food compared to soft
Mhm.
food. I have a patient who just drinks apple juice and nothing else, only apple juice, and that it's really hard. So there are nutrition definitely. I in general we all know that avoid too much of sugar, but there are not much evidence about gluten-free diet, because if you have a child go through malnutrition by restricting too much of wheat and stuff, they might develop malnutrition unless your child has a specific gluten sensitivity or a celiac disease or some issue with the gut. It does not help with autism. Gluten-free diet, obviously multivitamins, omega-3 fatty acids and all that definitely helps, but it's so restricted with the child's diet. So it's hard to restrict more or follow specific rules because they eat so less because of the sensory issues. And always having a nutritionist as part of the multidisciplinary team helps. And we always have our one of the nutritionists consult on the child or a dietitian to help with eating. They can either be over obese or they can have underweight too. And obesity is quite common as well, because sometimes they just eat junk food, and it's hard to control.
Thank you, Gauri, for asking such a wonderful, informative question. So we learned a lot as well with that one for sure. Okay, so there is another one from Vidya. It says, like, why is that most autistic children are good at an art, language, or something similar like that, like non-mainstream? Like, and how can it be explained neurologically?
Yes, that's an interesting question, which goes a little bit into science and the scientific approach. Autistic children have some deficits in the brain. The way the brain is formed, in simple words, it's a little different. So we all have this frontal lobe, it helps us with the execution and planning. And there is another area which is like the music area. There is another area which controls mathematics. And so we have different areas in the brain which helps with different things. In autistic children, there is a misbalance. So a lot of autistic children, they do not have inhibition. They just talk out. They don't have any inhibition on what needs to be socially appropriate. There are other autistic children who just like music and they keep singing on, and they're not interested in anything else. So there is a misbalance, and hence we need to encourage with those behaviors. For example, if a child is just interested in music, get them music therapy, and mathematics, just do something which they're interested in, and do not force your child to learn everything, especially with autistic children, because there is this misbalance, and there's a lot of research studies going on how to correct the misbalance in terms of medications or newer treatments. So hopefully there's a brighter future to help with those things.
There is a second part to this question also. She also wants to know that, is there anything like a prevention to take care of this condition, or especially in expecting mothers? So, what should be done?
So, expecting mothers, if you're suspicious, if there is a family member with autism, or if there is any suspicion, remote risk, any other risk factors, early age, younger age, like if there is a pregnant mom at 18 or 20 years, or if it's an older after 35 years, then please go ahead and ask your OBGYN for genetic testing and prenatal counseling. There are genetic counselors available throughout, and no question is dumb. And even if you do not have any history at all and you just are concerned that, hey, is there any way? Right now we do not have 100% way to check if the child will have autism based on when the mom is pregnant, but if there is a risk factor, there are some tests to do which can help us assess the risk. But there's nothing like, okay, all pregnant women get this test and it'll tell you if the child can have autism or not. Yeah.
Well, thank you, Vidya. That was a very, interesting question, and thanks for asking that. Let's also move on to the little bit about the, maybe we have a few more minutes. Let's know a little bit about the COVID questions that I have for you. I know that, it's very difficult to find the right, the person to take care of your child, or the, so what is that you're looking for if you want to go for someone that you want to choose, that, what exactly that you recommend for parents, that, that the qualities that needs to be there in the caretaker?
So the caretaker, obviously, if you can get your old ABA therapist or someone who can come in and continue the therapies, that would be awesome. Being very patient is very important. Being consistent and following the same rules. Call the school teacher or the ABA therapist and get a list of things what they typically do, and have the caretaker, either a babysitter or the parent, whoever, follow that consistently. Patience is the key, because a child is upset, and the older teenagers with autism, I'm seeing a lot of depression as well, with them not going to go to school and having their routine. Keep a routine, make bedtime the standard time, because autistic children go by schedules. Make sure you follow a strict schedule, and autismspeaks.org has a lot of resources. I know schools are closed, but you can still call the school district and talk to your school psychologist. You can talk to your therapist, get some tips. So do not hesitate to talk or call, because everything is shut down. People are still working on it, and you do have resources.
Right. So some of the schools are already starting in, some of the school districts already announced. So any specific quick tips for parents sending their kids back, especially autistic children, to back to school?
That's really worrisome. If it was my child, I would be really hesitant to send in general. The COVID thing going on, whether it be autism or not autism. But again, there is a mixture of ideas. Some parents are working, they're concerned if they're going to get the right structure, as in school with online education, there might be a difference. In autistic children, it's definitely challenging. You cannot expect a child with autism to wear a mask and sit at school, or to follow those strict hygiene guidelines, or not touch the child who is next to them. So it will be really challenging in the autistic community. So I would consider holding off or doing online school for children with autism, definitely until it slows down. Hopefully there is a vaccine or something which comes up soon, but it is really concerning. Or the other option is you can do like smaller classrooms, see if there is that opportunity for a smaller room if you really have to send. But definitely there is a high risk with the COVID going on to do face-to-face school compared to virtual schooling.
Thank you so much, Dr. Sailaja Golla. That is really an informative session, and we are very pleased with your, the wisdom and then all the information that you shared. Hopefully, all the parents who are watching or anyone who is going through this situation got benefit out of the show. And if, in case if they want to reach out online, so is there a website that you would like to give our audience?
Yes. So Shailaja Golla MD, it's a Facebook page. And I usually post information about conferences, new literature, research, and all that stuff. I also work for Texas Institute for Neurologic Disorders. So if you go to that Shailaja Golla / Texas Institute for Neurologic Disorders, you'll find information there too. And again, always call my office if you need to see me. I have Frisco, Plano, and Richardson locations, convenient. And I also do a radio show in Telugu almost once a month. It's on telugu1radio.com, and feel free to listen. Sometimes I do it more than once a month, but it's on a Monday, 5 p.m. But the MD website, the Facebook page, is the best way to get access to all these resources I mentioned to reach out to me.
So, also just to let our audience know that this show is also available for you to watch in case if you didn't get a chance to join us live today. And all you have to do is just to visit the Ayushia News Facebook page, or also the YouTube link is also available for you to watch. So thank you so much. I would like to with all my heart, that this is really a very difficult time for everyone, and thank you so much for taking your time and coming and answering all the questions, giving us the great information. I really appreciate it. And then definitely we will be doing another show in the future as well. Thank you so much. And this is your host, Anu. Keep watching, and we'll bring more quality programs on this Asia News Global Gupsup Show. Thank you so much. Have a good day.
Thank you.